I'm Dr. Howard S. Glazer, and I'm fortunate to be here today with Dr. Sargon Lazarof, who has been the inventor and genius behind a brand new implant-type device called the Ultratooth. Tell us what's unique about this product.
Well, first of all, it's the only FDA-approved implantable device that can be placed in full function at the time of placement.
So that means the tooth comes out and immediately that full functional tooth is there.
You can put a final crown on at the time of placement if you have a milling unit in your office.
Fantastic.
So we routinely do that, but there are added bonuses on it, which number one, we're preserving the emergence profile of the socket, so the patient doesn't have to go spend money on regaining it. What the beauty of this thing is that not only we preserve it, we can maintain it, because this is the only implant, when it's expanded, it becomes an Eiffel Tower and transmits the lateral forces apically away from the coronal region.
So what you're saying is the pods, if you will, or the legs, sort of expand, right?
Yes.
Okay.
And stabilizes it in bone. There's no micro movement. You can immediately put it in function. And by being the only device that is wider at the apex, it transmits the lateral forces apically away from the coronal region. So when you go 10, 15, 20 years down the line, you still have your papilla and the emergence profile.
That's incredible. And I assume because of the width that's created here, I'm going to get much more osseous integration.
30% increase in surface area, the studies shows, because internal of the pods gets osseointegrated. So a 10 millimeter Ultratooth is equivalent to a 13 millimeter screw. So the surface area is 30% more.
That's incredible.
There's one more bonus. The great thing, the studies that were done in Indiana University, histological studies, found out, and they called it an oscillating effect. By compacting the surrounding bone, you're affecting the quality of the surrounding bone. This is why we have doctors calling us when they place the device in tooth number 8, and number 7 is a natural tooth that had some mobility and some bone loss. They call us and say, hey, there's an improvement in number 7, now it's not moving anymore. This is the oscillating effect that occurs by compacting bone, and you get improvement in the surrounding bone area.
So you're actually solving a periodontal issue or a potential periodontal issue at the same time. That's fabulous. Now, difficult to place?
Very easy. 2 drills basically place it. We have one additional one that you just create an emergence for the crown. So, and the only thing is that you just expand it with a torque wrench to 20 newtons.
20.
Always 20 newtons. The only thing that varies is the amount of expansion, which is maximum 1.5 millimeters in hollow bone. But typically in the extraction side, you got type 2 bone, which means less than 0.5 millimeter expansion to give you that mechanical retention. Now, this is placed in all kinds of teeth, regardless of whether you have a buccal plate or not. You have to be lesion, we put it in endodontic cases, endodontic failed cases, periodontal situations, because we're creating a brand new socket palatal to the old socket. So the only difference is that if the bone is missing, the buccal plate is missing, you put a graft to maintain the gingival contour. And if there's a big lesion, you do it open. If it's not, you just do it through the socket.
So the beauty of this, as I see it, that is this is a same day, all-in-one, fully functional. Whether if you mill a crown, they get it. If not, you put a provisional on.
Exactly.
So you're telling me I take a $200 extraction and I can convert that to a $2,500 implant?
Minimum, exactly. And some doctors are charging much more for that. But this is why we call this the Ultratooth. We do manufacture implants, dental implants, but the Ultratooth has the 5 points that addresses the failure or shortcomings of the dental implants.
Okay. If I want to learn more about this, there's training?
Yes, we have, every month we have training. They're booking really fast, so the only open ones are like in February right now.
Terrific. So I imagine for more information, we would look at www.biodent.com.
Biodentinc.com.
Biodent, INC.com.
Yes, yes.
Terrific. Thanks for being here with me today and sharing what is truly an Ultratooth that will really make my patients really happy when they leave chewing and functional.
Thank you.